Hi. First of all, thank you everybody for continuing on with all of our recommendations that we've given you and that, staying in your house, social distancing, everything that we've suggested, the majority of the community is doing. And we're really proud of you all because it's not easy, I know. I want to remind you that if you're talking to public health and we ask you to self isolate for whatever reason, that you respect those instructions and you remain on them until the time that we tell you it's safe to come off of that. Okay, that's for particular people if we have contacted you. Something that we wanted to address that came up recently was the use of skidoos. I know a lot of people are leaving the community on skidoo, going up so far, hopping in a truck, and then going on to Goose Bay. My concern is that there's weak areas in the ice. We all know this has not been a normal winter for weather, and there are weak areas and holes in the ice in a lot of different spots between the Northwest River Channel there and up into Lake Melville. So if you're going to do that, please know that you're taking a big chance with your life, especially at night, especially if you're not familiar with those areas, and I'm sure some people are not. So at the end of the day, you're going to make the choice, and I can't stop you, but please think about the people in your families, think about the people that are close to you, make the right choice, make the smart choice. Like I've posted on my Facebook, my dad's advice just keeps coming back to me time and time again with all of this, and that is that life is a bunch of choices. So make the right choice. Now, we've had some people contact us about alcohol and people that do have addictions, having some problems now coping without the alcohol, and concerns that they could end up in medical trouble. If you know somebody, a loved one, a friend, a family member, whatever, somebody that's going through alcohol withdrawals, you need to know that there is help available. You can call 811 for advice. You can contact the emergency department at the hospital at 897-2357. You can call the clinic during daytime hours, Monday to Friday, at 497-8202. You can even use the Medicuro app. You'll see that on our public health Facebook page. You have to understand that alcohol withdrawals are not treated by more alcohol. Alcohol withdrawals are treated by medication and multivitamins in the hospital. This is really important to understand that if you're going through withdrawals, you need to call the numbers I mentioned and you need to tell them that you're having symptoms of alcohol withdrawal. Then you need to follow the directions given to you by the person on the phone. We're going to post some information on our public health Facebook page about alcohol withdrawals and the different stages of alcohol withdrawal so that you have the information if you feel you need it. Now, the common signs of alcohol withdrawal include headache, clammy skin, shakiness, really tired, fatigued, loss of appetite, and difficulty being able to think clearly. Those are the main signs. When you really need to start to be concerned is when you have somebody that's having hallucinations, so that's seeing or hearing things that are not really there, mental confusion, irritability, really irritable, withdrawal seizures, so they're starting to have some tremors and seizures as a result of no alcohol. And sometimes they'll have an increase in blood pressure, so you might see them turning really red and having that confusion. So make sure to keep an eye on that. And if you see those symptoms starting to happen, then it's important to call for help because things can get worse very fast. And here are some numbers that you can call if you need to get support for mental health or addictions. So thanks again, everybody. You're doing a wonderful job. Please remember that this pandemic is not going to last forever. It does have an end in sight. It's going to be a little longer than we thought, a little longer than we had expected and hoped, but the end is in sight. You're doing a great job. Please, please trust your chief and council. They are doing a wonderful job. Karen and I at Public Health have got all our trust and faith put into them as well. Thanks.